The connection between ADHD and schizophrenia. Scientists believe that there is an overlap in the factors that can lead to ADHD and schizophrenia. Attention deficit hyperactivity disorder and schizophrenia are two different disorders that can profoundly affect a person's life. While they have many differences, they also share some characteristics. Attention deficit hyperactivity disorder (ADHD) is a chronic condition that involves behavioral symptoms, including inattentiveness, hyperactivity, and impulsiveness. Schizophrenia is a long-term mental health condition that affects how a person thinks, feels, and behaves. It involves psychosis and other symptoms, including inattention. Both condition involves neurodevelopmental changes and can run in families. However, researchers do not yet know whether the same changes relate to both conditions or to what extent these underlying features overlap. Does ADHD medication lead to schizophrenia? Some people who use stimulant medication to relieve the symptoms of ADHD go on to experience symptoms of psychosis. However, it is unclear whether using stimulants to treat ADHD increases the risk of schizophrenia or schizophrenia-type symptoms, specifically psychosis. These symptoms may have appeared without the use of stimulant medication. However, it remains unclear whether psychosis results from the use of the drugs or whether the individual is already susceptible to psychosis. In addition, the type of psychosis that people with ADHD experiences tends to be different from that in people with schizophrenia, as it involves brief mental changes rather than full hallucinations. ADHD and schizophrenia symptoms. Children and teenagers with ADHD may be 4.3 times more likely to develop schizophrenia as adults than people without ADHD. Close relatives of people with ADHD may be more likely than second-degree relatives to receive a diagnosis of schizophrenia, suggesting that it may have a genetic component. Having a short attention span and getting easily distracted, making careless mistakes during activities, appearing not to listen, being unable to follow instructions and complete tasks, having problem with organizing tasks, being forgetful or frequently losing things, avoiding tasks that require mental effort, hallucination delusions such as believing that the government is pursuing them, paranoid thoughts, agitated or excessive body movements, agitated or inappropriate behavior. Thank you for watching the video. Subscribe to our channel to keep watching such content.